Hello and welcome. This is Dr. Jude Maimo. I'll be performing a laparoscopic appendectomy using a simulator. Now, before we begin, few things to note. The appendix is in the normal position in this patient. And before the procedure, the first thing is to explore the abdominal cavity. So you can use your camera using the views you think it's most appropriate for you. I usually go with direct view first, and then I'm going to switch to different views. So you can freeze, you explore the peritoneum, and you can rotate however you want. Now, this is just the first thing to do. Now, the second thing is, since it's a simulator, I have to freeze at the organ in question, which is the appendix. You can see it clearly there. So I'm going to freeze. Then the procedure begins with selection of my tools. So I love Maryland dissector. Different surgeons prefer different tools. So I use an automatic grasper. Now remember, when you insert your tools, you have to be gentle so you don't injure internal organs. Now I'm going to pick the appendix at the mesoappendix a little bit and then hand it over to the right grasper. From here, I can now start to create a window between the appendix and the mesoappendix. This window is going to help me to divide the appendix, and it's also going to help me to divide the appendiceal artery. Now you have to make sure that you actually create the window at the base of the appendix, because there are situations where the appendix is not completely resected and you have a stump left, and then we can still find ourselves with a similar complaint and have to redo the surgery. Now I have a great window at the base of the appendix. The next is to create a window for the appendiceal artery. This is going to help me to be able to control the bleeding, possible bleeding. If it's properly done, there won't be much bleeding in real life situation. Now you can see the artery right there. Now you can see this is the artery running, and that looks pretty good. So what I'm going to do now is to get a clip. I'll place a clip. Now for safety, we usually place 2 clips at the proximal end and then 2 at the distal end. And then with an energy device, again I go back to, we use an energy device because it's good to cut and coagulate at the same time to avoid. Okay, that looks good. Then I can separate this extra tissue. And always make sure that you evaluate the depth of insertion of your tool so you don't injure the organs beneath or tissues beneath your operating site. So what I'm going to do next is to place an endoloop. This is normally advisable because it provides safety. So I'm going to place my endoloop. And when you handle the appendix, you have to be very gentle. I place the first endoloop at the base of the appendix. That's good. And then I can cut with the scissors. Okay, then I get my grasper one more time and then place the second loop. The second loop about 2 to 3 millimeters from the first loop. Okay, that's done. And then I get my scissors again to cut the suture. And then one more time, the next loop will be placed distal to the appendix. That will be a single loop distal to the appendix. This looks like a good position. Okay, the loop is placed, and then I can get a scissors to cut. Okay, now there are different options. There is no single correct way to separate the base of the appendix from the rest of the appendix. You can use a stapler. You could use a linear cutter to do that. And some surgeons will just use the scissors and then coagulate the cut edge. So whichever you decide, it's okay. So in this case, since we have all of these in our disposal, let's explore. So we could just use a linear cutter to separate the appendix. Okay. Now I'm going to gently pick up the appendix and then place my linear cutter between the loops and make sure. Okay, that's done. Okay, next is to get an endo bag to retrieve the specimen. Place in the bag, and then I can retrieve the specimen. Now, the next thing to do for extra safety for the patient, it is usually advisable to apply some heat energy to coagulate the cut edge. And okay, make sure. Okay, now we're good to go. So this procedure is complete. What I do next is I can irrigate and suction to clean up probably from any debris. Okay, Now that looks good. So what I'll do at the final step is to explore the abdominal cavity one more time. Looks good. There is no fluid collection and everything looks fine. Okay, so the procedure is over. Well, thank you very much for watching and see you in the next one.